Hello there. The big pharmaceutical and political undertakers have been doing their best to bury this story, but what we now hear will make your blood boil. Why aren't heads rolling? From politicians to government officials to big pharma bosses to healthcare professionals to the likes of the BBC and Sky, as well as the advertisers. And as far as I'm concerned, they were and still are all complicit in death and injury. Not just in the UK, but worldwide. We had that Astrazeneca Triumph for British Science arm intervention that was first released back in November 2020, pushed all the way for all it was worth. Safe and efficacious, the establishment shouted, and scorned any calls for caution and forcibly squashed any claims to the contrary. And in the process cancelled huge swathes of the scientific community who dared to put their heads above the parapet and call foul. They were sidelined and some even lost their licence to practice. They even forced some people, by law, to accept the medication or face losing their livelihoods. And now we hear that on the 5th of March AstraZeneca quietly applied to the EU to voluntarily drop its product's marketing authority. Something that the EU agreed to on the 27th of March in an EU Commission implementing decision that came into force in the EU yesterday, the 7th of May. The EU implementing decision said that it was withdrawing, at the holder's request, the marketing authorisation it granted in 2021. But I can see no reason given for the company's decision. But the company had recently admitted in court that its product caused an extremely rare but fatal side effect. And it seems they are saying that it's being removed from the market for commercial reasons, as it is no longer being manufactured or supplied because it has been superseded by newer products. And the wife of Jamie Scott, one person who claims they were badly afflicted by it, said, "They say it's for commercial reasons, but maybe it's because it can no longer be seen as being within the acceptable safety parameters." But a company spokesperson said, "According to independent estimates, over 6.5 million lives were saved in the first year of use alone, and over 3 billion doses were supplied globally. Our efforts have been recognised by governments around the world and are widely regarded as being a critical component of ending the global pandemic." However, some might say that it would have ended naturally anyway. And they might also say that it is in the interests of all those that pushed such products to claim their success for their own personal, political and financial survival. Mightn't they? Just saying. Now, as I recall, some eminent physicians, you know, the ones that had been cancelled from the press and been sidelined, had been warning that this sort of thing would be possible in such a global rush, hadn't they? And this is what happens when free speech is suppressed in favour of the "we know best" brigade. Anyway, campaigners who have suffered or seen others suffer due to this have welcomed the company's decision, saying that it means no one else will suffer from this awful adverse reaction. And according to reports, 81 people have died from this. And I wonder how many more were put down as non-related deaths and injuries, so as to keep the population on the correct medicinal path, so to speak. How many people had their deaths and injuries recorded wrongly as natural causes or down to the health emergency itself, instead of what many were coerced into taking? Yes, coerced with no proper explanation as to the status of the substance and their part in what was a clinical trial, not the recipients of a tried and trusted product. No informed consent. Now, as I understand it, this withdrawal will be worldwide, but I had a quick trawl through the UK government agency's website and found nothing on it there. Maybe I missed it. Why hasn't a UK government that is still so locked up in the EU machinery not just copied Brussels on this issue? After all, it was quick enough to push it out in the first place, wasn't it? Now, this is the bit that will boil your... There might be a massive issue with timing here, because the Daily Mail is reporting that there is a 3-year cut-off date to claim compensation, quoting one lawyer, Sarah Moore, a partner of law firm Lee Day, saying, "For the claims we are bringing, those injured or bereaved have 3 years from the date of their injury or death in which to bring a claim. So unfortunately, in many cases, that cut-off has now been reached." And on a completely different topic, Astrazeneca shares jumped 1.6% on the news that it had withdrawn the product, adding more than 3 billion quid to its valuation. Now, why would that be? Now, theirs was one of the many products swilling about the medical market during the health emergency, with some 50 million doses being pushed out in the UK by them alone. And if you remember, the government health agencies were all for a mix and match approach. At that time, they just wanted as many people as possible to keep rolling up their sleeves and accepting whatever dose was available whenever it was available. It didn't matter what you got or in which order, they said, just keep taking it. So I wonder how many people now have any clue what doses they took, when, and from which provider. And the way this whole matter has been treated, from billions upon billions making start to finish, I wonder if the records are still available. Now, one of the big plans, if you recall, was to push this stuff out twice a year for everyone, from cradle to grave. And those like Bill Gates were talking about this being the way ahead for the human race. A constant stream of new and updated doses being delivered to the global population every 6 months or so. Big Pharma and those that had invested in it were rubbing their hands with glee. The potential to become obscenely wealthy overnight was within their greedy grasp. And many more autocratic politicians were slavering at the prospect of unlimited control over their populace. We were on the cusp of much of the world's governance putting in place laws to make it illegal not to be medicated, on pain of being permanently under house arrest or even having the heavies sent round to subdue you and ensure your compliance, as happened in many places. We were so close to that dystopian moment. But people began to wake up to the threat, and those greedy and power-hungry people were forced back inside their box. But only temporarily. They are still there, plotting and waiting for the right moment to basically enslave the human race. The WHO pandemic treaty is still out there, being readied to allow those power and money-hungry predators to pounce and control us, remove our freedoms and continually fleece us, and worse. And I don't care if people say this new treaty won't be misused, because our weak politicians will sign up to it. Then they can let the WHO take the blame for making them implement all the draconian health decisions emanating from it. Not our fault, they will claim. And as I've pointed out before, they are already claiming that the climate and health are extremely closely related. Therefore, health decisions can be imposed upon us for climate reasons. Along the lines of mass migration and the mass redistribution of wealth must be achieved for health reasons for the masses due to climate change. Get the idea? And they are still pushing for this. Be in no doubt.